What's up, YouTube? It's me, Jamie K, and today we are going to be talking about my Nclex resources. I recommend taking some notebook paper or a flashcard, whatever you want to use, and making a page where you list your weak areas. So while you're studying and you're studying something and you realize that you need to go over it some more, or you need to review it, or you have no idea what that is, just write it down and then go over it. My weak areas were chest tubes, insulin peaks and durations, cranial nerves. Oh, cranial nerves was definitely a weak area. DKA, autonomic reflexia, the dosage questions, prego drugs, diets, burns, tracheostomies. I wanted to review tracheostomies. Non-stress test versus the oxytocin challenge test. I know what they are, but I always get confused with non-reactive versus reactive, and then negative versus positive. I always got confused like which one went with each test. So I wanted to review those to make sure I had it, and then I just wrote down like vitamin K in babies and like the erythromycin ointment and the shot that you give once the babies are born. And then also wanted to go over emphysema, precautions, like the different types of infectious diseases that go with each PPE, because I've heard that like that's very important to know for the Nclex. And then lab values, of course, developmental stages. Oh my gosh, this gave me the most anxiety ever, was trying to memorize and know the developmental stages. And then RH factor with the maternity. And I wanted to go over the heart blocks, fetal heart rate, and I wanted to always go over normal vital signs, like adult vital signs versus pediatric vital signs, because even though we're both humans, they're two totally different categories. So I wanted to go over the differences between those. And then crutches, gaits, and positioning. So that also brings me to another page in my notebook that I had, was strictly on positioning. So I'll show you. So for example, you want to increase the head of the bed so you can decrease the workload on the heart and increase cardiac output. So it's the way that the heart is positioned in the chest which increases the cardiac output. So increasing the head of the bed is majority of the time the answer, with a couple of exceptions. So then when you're lying supine, it increases the workload on the heart. So if someone's having a heart issue or heart troubles, you wouldn't want to lay them on their back because that increases the workload on the heart. You would want to increase the head of the bed. So certain things like that, just writing down little facts about positioning was very helpful for me. So while I'm studying, I'll be able to just write down, you need to lie this way with this procedure, and you need to lay this way after the procedure. So for example, with after a lumbar puncture, how are they supposed to lay post lumbar puncture? Supine. And why do they lie supine? To prevent headaches because of the CSF leakage. Just being able to know what position, and not only what position but why. So then epidural, you can lie on their left with their legs flexed, or you can prop up over side the bedside table. I always got Trendelenburg mixed up. So Trendelenburg is with the feet above the head, and I have a little guide so I can remember right there. So reverse Trendelenburg would be like that way. Post tonsillectomy, you want to lie them on their side, raise the head of the bed. It's to prevent aspiration. If someone is epistaxis, if someone is having a nosebleed, you want to lie them upright, pinch the bridge of the nose, and facing forward. And then some of them weren't always about like a procedure. Some of them were just positioning that you need to know. So like epistotonos, which is what Mark Clemming talked about, and that is when the baby hyperextends with bilirubin in the brains. Their body makes like a rainbow shape. Bilirubin is not supposed to be in the brain, so that's the problem there. Dumping syndrome, lower the head of the bed during meals, and then hiatal hernia is the opposite. So you increase the head of the bed so that gravity can help everything go down faster. And then with dumping syndrome, it's the opposite. Lower the head of the bed so it doesn't just dump out all fast. So just knowing that there's an opposite there. Just like Mark mentioned, if you know one thing, you can make sense for the other one because they're opposites. Lithotomy position, prolapse cord, pregnant lady with back pain, you want to do knee to chest position, push on the sacrum. Post-op laminectomy, no sitting, no dangling. Sitting is bad. I always got recumbent positioning. I had to look up stuff like that. So a positioning page is really important. And then also I had a page for diets, because diets was so stressful for me. Even in nursing school, diets were always, I would always miss diet questions. And you would think that those are the easy questions, but sometimes I just don't know. So for example, brat diet, fiber, cystic fibrosis, protein, sickle cell, calcium, milk, vitamin D, vitamin C, ascorbic acid, type 2 diabetes, dumping syndrome, hiatal hernia, carbs, tyramine, and ulcerative colitis. I just wrote down things you need to know about each diet. So what foods have fiber? Raisins, apples, avocados, raw fruits, and veggies. Cystic fibrosis. A patient comes in with cystic fibrosis. What should you educate the parent on what the patient can and cannot eat? Select all that apply. So you would have to know that cystic fibrosis, they have trouble absorbing fats. So extra dairy, extra fat, protein, and salt are good for growth and development for a patient with cystic fibrosis. High in salt, like potato chips and hot dogs. Extra protein, like bacon, whole dairy products, milkshakes, butter, cheese. High fat, yogurt. So just knowing that patients with cystic fibrosis need things like that versus a patient that doesn't have it, these things will be bad for a patient that doesn't have it. So that was just something that I need to know. So now going back and just being able to review, it helps bring it back to my memory. And then what foods have protein? Protein, just knowing that protein does the opposite of carbs. So it bulks the gastric content, takes longer to digest, and it moves through the gut. So like hot dogs. The body needs vitamin D to absorb calcium. Vitamin C enhances iron absorption. With diabetes type 2, you want to restrict calories. So this is not a class, this is not a teaching lesson. I'm just showing you guys like simple, easy, quick facts that you can write down to help you remember things during your NCLEX. So I'll recommend a positioning page and a diets page. And anything that you may struggle with, I recommend just making a page for it. And as you study, just write down quick facts for you to remember and review. Did I study the day before? I studied the day before. I did. I shouldn't have, but I did. However, I did not study the night before. I studied the day before, the afternoon before, and the evening before. However, when I got there around 7 or 8 o'clock, when I got there, I took the shower, I just went to sleep. I didn't study that night, which was very relaxing for me. I didn't study the morning of either. I swear by this. If you've watched my previous videos, you would know that I always recommend studying with a study group. I definitely recommend studying alone first, like in your own room or wherever you study. Study alone first, but study with a friend. That's what helped me get through nursing school, is studying with a study buddy. Whether it's 1, 2, 3, or 4 people, not too many. I've always only had 4 people in my study group. So my friends Deja, Kennedy, Corinthian, Chris, Jalen, we all have Amber, Cameron, we all study together, and they're so helpful because some things that I don't know, they might know, and then they'll like refresh my memory on something that I forgot and vice versa. So I definitely recommend studying with a group at least a couple times out of your study time, at least a couple times with friends. We also had a plan to order this game off Amazon called Our Entertainment, and my friend told me about it, and we were going to download it and just play the game before the test, but everyone's test date was different, so it never worked out. But if it works out for you and your friends, you should definitely try it. That's all I have for you guys. If you guys have any more questions, I definitely probably didn't answer all your questions. I remember watching videos and I'm like, oh, she didn't answer what I was looking for. But her video was informational, but it just didn't answer what I was looking for. So if you have any more questions, any type of questions you have, let me know in the comments below. Just let me know because I want to help you as much as I can. I've always wanted someone to be there for me. I hope that this video was very informational and very helpful. It was kind of longer than I expected, but I hope that you guys can find valuable information in it. And just don't forget to be positive and to pray. Definitely pray. I only got through this because I prayed, because God was with me every step of the way, because of my support from my family, my friends, even people I didn't know were supporting me and telling me that I could do it, and that goes a long way. And thank you for watching this video. I will see you guys later, and toodaloo.